Good afternoon, Balamurgan sir. Balamurgan sir, can you hear me?
Good afternoon, sir.
Okay. Sir, HOD sir. HOD sir, you can just give a welcome address, sir.
Okay. Having universal healthcare saves everyone. Very good afternoon to all. Really, it gives me a great pleasure to invite you all and welcome you all for this 2 hours webinar. Today's speaker, Dr. S. Balamurugan, ACM Distinguished Speaker, for today's 2 hours webinar on smart healthcare system with special focus on COVID-19 pandemic. It is well known that for more than 1 year, across the globe, each and every human being have been affected and suffering, and also relevant to this pandemic, we have a lot of disturbances in our daily life activities. This is the right time across the entire people or across the globe, we have to create an awareness. In this regard, the Electrical and Electronics Engineering Department has come up with an excellent idea and initiated to have a very small webinar in the direction of pandemic COVID-19. So, in this regard, I welcome Dr. S. Balamurugan to have a 2-hour session on this, and I request all the participants and the registered candidates to take the benefit of this 2 hours webinar. I also thank our departmental coordinators, Dr. Mohandas, as well as Mr. Vinod Kumar, in taking initiation and putting effort in coming up with 2 hours webinar. Thank you once again. Thank you one and all. Over to Dr. Mohandas.
Thank you, sir. Thank you, HOD sir, for giving a good introduction about our program and our chief guest. Thank you. Now we will be seeing about the introduction to our chief guest. So Dr. Balamurugan, Dr. S. Balamurugan, he is the ACM Distinguished Speaker. He received his B.Tech degree from PSG College of Technology, Coimbatore, India. M.Tech and PhD degrees from Anna University. He has published 57 books, 300 international journals and conferences, and 79 patents. He is a director and research development, Intelligent Research Consultancy Services, IRCS, Coimbatore, Tamil Nadu, India. He is serving as a research consultant to many companies, startups, SMEs, MSMEs. Also, he is an editor-in-chief for the following book series: Artificial Intelligence, Soft Computing of Industrial Transformation, John Wiley, Artificial Intelligence of the Learning Technology for Engineering, Bentham Science, Advances in Quantum Computing, Artificial Intelligence and Data Sciences for Industrial Transformation, CRC Press, Advances in IoT, Robotic and Cyber Physical System for Industrial Transformation, CRC. Focus book series and IoT, Artificial of Internet of Things, CRC, Press, Taylor and Francis Group. He is the editor-in-chief for Information Science Letter, Natural Science Publishing, NSP, and International Journal of Robotics and Artificial Intelligence, PRIRS, USA. He is the associate editor of IEJCE Transactions on Information and Science, Oxford University Press, and Cluster Computing, Springer, and Simulation, Sage Publishing Technology and Healthcare, IOC Press, Intelligent Computing, InterScience, World Journal of Engineering, Emerald, International Journal of Intelligence Systems, Technology and Application, InterScience.
Sir, we can shorten it, sir. If you
Yes, sir. So I hope a vast, brief introductions are there. He is also an Asia Award from former Governor of Sikkim, Jewel of India Award from the Gurpreet Singh and General Secretary of India, Star of Asia Award from Mr. Kon Debrashni, former Prime Minister Thailand, in an international seminar in Bangkok. He was awarded by a prestigious Mahatma Gandhi Leadership Award at the House of Commons and British Parliament, London, UK. The book has been authored on the machine language and deep learning algorithms. MATLAB and Python was the best MATLAB book for the beginners awarded by Book Authority. Dr. S. Balamuran was the CSA Young IT Professional Award. He is the winner of the National CSA Youth of Expectation. So we have a strong expertise for today's program as the eminent speaker. As the great one is the ACM distinguished speaker who is going to deliver a lecture for us in the topic Smart Healthcare System with a special focus on COVID-19 pandemic. Welcome you, sir. Welcome on behalf of New Horizon College of Engineering and Distributed Department. Thank you, sir.
A very warm afternoon to one all present here. I convey my wishes to the Distributed Department, specifically for the Professor and Head Dr. M. Magesh sir, and Dr. R. Mukunda sir, and Mr. Vinod Kumar sir, for inviting me for the webinar on this particular topic. And so since the target audiences are about is on UG students as well as the PG students, I have what I have decided is to focus more on the practical part, which means the application, what is the current scenario and other things, and then minimize the theoretical part because it is an afternoon session. So I know the difficulty of looking into as well as listening to the webinar. So let me be focused on more practical aspects rather than on theoretical. So I have a slideshow. I will present the same. If you have any questions, you can kindly wait till I finish the presentation, and at the end you can either ask me or you can either mail me. I will be able to answer your questions the offline. Okay. So shall we go to the presentation? Any one of the students, please kindly unmute your mic and tell me, shall we go? Okay. Are you able to view my screen? Is it visible?
Yes, sir.
Okay. Thanks. So today's topic on smart healthcare management system with a special focus on COVID-19 pandemic. Ma, if you have unmuted, you can kindly mute yourself and able to hear the echo. So this particular COVID-19 pandemic is we haven't expected this very unexpected disaster. Either it is a natural or man-made, which we don't know. However, it is an unexpected disaster. But whenever life hits us with some disaster or any challenges like this, we should be able to find what are all the opportunities by which we can actually grow. Of course, COVID-19 I mean, is as well as was a deadly disease in the last year. Please kindly mute your mic, participants. I am not able to present here. Okay. So this even during the last year as well as this particular year, COVID-19 has affected a lot of people and has taken a huge number of loved ones' life. And it has caused a lot of distress in a lot of families, economic problems. There are a lot of things out of which, I mean, multidimensional problems which arises out of this COVID-19 pandemic. However, we as
Sir,
engineers and
Balamurugan
technologists,
sir, Balamurugan sir, sorry for the disturbance. We could not see your presentation, sir. We can see only the screen.
just a second. So whether this particular screen is visible, sir?
No. So only the participant screen has been shown. The presentation is not shown. Just I referred with another one.
Okay. I will share it again, sir.
Yes, sir. Please.
Is my screen visible?
One second. Yes, sir. Now it is been, sir. Yes, sir. Now we can see, sir.
Sir, if possible,
Sir,
make
now
it
we
as
can
a
see.
PPT presentation, sir. Presentation, make it as a presentation, sir. So it is.
Slideshow, you can go, sir. Slideshow.
Yes.
You can go for slideshow, sir. It is not in.
So hope you are able to see the first slide, smart healthcare management system.
Yes, sir.
Okay. I'll just move through the slides where you just kindly let me know whether you are able to, whether the slide moves in your side also. I have moved on to the second slide, sir, whether it is moving on to the participant's side.
No, sir. Second slide we are not able to see now. Only the
fine.
first page is.
Okay, let me present it in this format itself. Probably when I make it into a full screen, this is probably not able. Are you able to see the second slide?
Oh, yes, sir.
Third, everything. Okay, fine.
Yes, sir. Fine, sir.
Okay, fine. Let me proceed with this short screen, sir. So as I mentioned earlier, so COVID-19 has taken, it has created a multidimensional problems like financial problems, many job losses, life losses, many. So all these things are a very complex thing which we have not foreseen, we have there's no experience like this before, at least for our generation. So whenever there is such type of pandemic happens, something which is abnormal which happens, so when any difficulty is there, so we have, as engineers and technologists, we have to look into what are all the opportunities where we can actually look into and provide solutions for the people to overcome this particular pandemic. So with this focus, we'll just look into what are all the problems as well as the solutions what we can actually provide, and a few of them are actually mine. So first problem. So you might have so still till now the COVID cases are increasing, and still daily testing are being done at government hospitals and also at private hospitals, certain private hospitals. But when you look at the swab test which is being performed, it is actually performed by a person, right? A front end healthcare worker who actually inserts a needle-like thing into our nose, or either through our mouth, through to the throat, to collect our sputum for testing, a sample of our sputum for testing. So this is a general process of a swab test. If you look closely into this particular testing process, the person who actually takes up this particular the person who takes this test, I mean, who's performing this particular the healthcare worker, is more subject to risk for this particular COVID-19, because we don't know whether the person who's actually getting tested will be COVID positive or not. However, the healthcare workers, they test for multiple hundred and thousands of people per day. So there is a high amount of risk which is being witnessed in case of the front-end healthcare worker who actually takes up this particular test. And so in order to solve this particular problem, what we can do is that we can alleviate this person, and we can go for automation of this particular process. Okay, so we can design a small robotic arm in such a way that a person can come and rest his chin on a place, and this particular robotic arm will be able to intelligently detect using the face detection techniques. So where is the nose of that particular person, and how and where to insert this particular stick or the needle to not to collect the sputum. The importance over here is that importance should be given for the accuracy of this particular system. Okay, see, we are going to insert a needle, a flexible needle or whatever maybe it is, into the mouth or throat of the person, and we are going to automate this particular thing. So we have to be very, very careful in the accuracy of designing of this particular robotic arm and functioning of this particular robotic arm also. So even if the particular, the few changes in the angle of the insertion is wrong, then probably the person will get hurt with the particular needle or the stick. So the importance is to be given to the precision, the accuracy of how we are going to automate this particular process. So here you can see a small, a chin rest, where a person, any person who's coming and resting his chin, and the posture is being fixed. And here we are having a robotic arm, and this you can see a small a stick over here, which is being inserted through his nose, either through nose or throat, for performing the swab test. So once it is being collected, then the person leaves. Then, if suppose the next person comes for the test, then there is a possibility for the risk of infection for the second person, because the first person who has tested with this particular apparatus, he has rested his chin over here. So there should be a mechanism in order to, for automatically sanitizing this particular resting device, so that the next person who's coming to test will not catch infection from this particular device. Okay, so two things were most important while automating this particular process. First one is the degree of accuracy of working of the robotic arm, and second one is the importance of disinfecting the chin rest before and after the test is being performed for a person. Yes, this is another research opportunity out of this COVID-19. So it is like we all know that we are under complete lockdown. So Tamil Nadu is also under a complete lockdown. So people we are all at home, and people who are infected with COVID, few people are actually made are hospitalized, and few people with asymptomatic, with the less symptoms or fever, breathing difficulties are advised to be at home quarantine with some medicines. So suppose if a home has a person with the COVID positive, he's been quarantined in one particular room, and all the food, what are the food which is being served to him or her, the utensils are being cleaned, washed by him, everything is safe. But what about the toilet just being used? Okay, so as of lower middle class home, we cannot expect each and every room to be bath attached rooms. Okay, there are, huge number of population are there, and there are maximum of the homes have only a single toilet, which is being shared by all the family members. So suppose if a COVID positive person in that particular family uses this toilet, and suppose if another person also uses this particular toilet, there is a possibility of transmission of COVID virus through this usage of this particular toilet also. Okay, since we have only one, we have no other go. Okay, of course, upper middle class, they might have some facilities of having 2 to 3 toilets in their home, but mostly, in the majority, like we have a single toilet. So cleaning or sanitizing this particular toilet by the COVID patient is also difficult, because the COVID patient, he himself or herself is under a great difficulty. So that once after him or her is using this particular toilet, it is very difficult for him or her to sanitize it and other things, because physically they are not well. And similarly, any other supporting persons from their family, they also cannot go and clean the toilet or sanitize the toilet, because there is a possibility of getting the infection. So in such a case, then we have to use for automatic cleansing toilet. Okay, so this designing toilet in such a way that the toilet senses that one particular person has used the toilet, and immediately the toilet, the sanitization mechanism is being automated, and then the next person enters and he uses the toilet, again it is being sanitized and then goes on. So this is one of the research opportunity out of this COVID-19, how we can actually help people at home quarantine, supporting family members at home quarantine, to not to catch infection of this COVID through the usage of toilets. And the diagram, the figure which is on the right side is actually like during the first wave of this COVID-19, there was a huge, the majority of the people who got infected by COVID are elder people, senior citizens. Right? And in the second wave, of course, people in the middle age are also getting affected, and of course, senior citizens are also getting affected. So in such case, suppose if keeping in the mind of the difficulties of the senior citizens and the usage of the toilet during the time of COVID. Okay, so senior citizens, they might have a comorbidity or might not have. But suppose if they have a comorbidity, for example, if they have a blood sugar level and blood pressure level as well as COVID, then it is very difficult for them to clean their body once after the passage of the toilet. Okay, so what we can do is that we can go for an automized toilet cleaning along with the hand rest. So what is being given over here is a hand rest, especially for elder people who find it very difficult for them to even at least sit in the particular toilet. And also an automatic cleansing mechanism is also being designed in such a way that we will be able to help the person using this particular toilet and clean. Okay, and another thing, of course, you have a small wash station also over here. So whatever, suppose if the person, COVID positive person, washes his or her face, the same water could be reused for flushing. Suppose in case if the toilet is being exclusively for the particular COVID patient. So this is another research opportunity. Moving on, so this we actually go for So we know that the government has rules of whenever we go out, suppose we are not supposed to go out, suppose in case if there is a necessity during this particular lockdown, suppose if we go out, we should definitely go for wearing a mask. Okay, there is a necessity. Wearing a mask is a necessity. So just so wearing a mask, suppose you consider the situation before this complete lockdown, when there was a partial lockdown, and so people were outside along with the mask. So suppose if a person who's able to see, who's to see, who has the vision. Yeah, suppose if he walks through the road and he sees a group of about 5 to 6 people crowded in one particular place, then what he or she will do? He will, though the person is wearing, though he or he's wearing a mask, he will wait for some time because it is not advisable to go to near the crowded place. So until the crowd, for example, if it's going to be a grocery shop and 6 to 7 people are gathered over there to buy the groceries, then the person who's actually masked will wait until this people dissolve, and then his or her turn comes, then he may go. Suppose you consider the case of visually impaired people. Okay, visually impaired people, they of course they do wear mask, but they will not be able to know I mean whether the place is crowded at least a few meters ahead of them or behind them. Okay, and there is a possibility that visually impaired people may go to places which are a bit crowded. So in order to avoid that and also to help the visually impaired people, what we can do is that you can design a smart mask so that mask will be able to detect the people. I mean, suppose if there are more than about n number of people, for example, 5 people crowded in about a few meters, 50 meters, then the mask will be able to give an alert to the sister to the visually impaired person that there are few there's a small crowd over here. So so this could be you can actually wait and we can actually just a small buzzer so that they'll be able to know that there is a crowd over there, thereby minimizing the chances of getting infected. This is another research perspective. Um, so this is a very generic thing, generic research opportunity out of this COVID-19. So this is an automatic dispenser of sanitizer and masks in this COVID pandemic. Now it has come to practice. Many of the railway stations and not even or centralized bus stands, they do have this this dispenser where they can deposit the money and can get the mask or sanitizer or whatever the thing. But again, there is a problem. Suppose if we deposit the money or coin, whatever maybe it is, so there is a human to machine contact over there. So suppose if one particular here, there's one particular lady who wants, for example, a mask as well as a sanitizer as well as some other things, very necessary thing. Okay. Suppose if the person touches on to the system, then the other person comes, then there is a possibility of risk of transmission to the system also. So in order to avoid it, so what we can come out is with this particular dispenser, we can have this QR code. Okay, so nowadays we have this QR scanning mechanism and paying the money. Okay, and each just like Arogya Setu app, the Arogya Setu app is an app which is proposed by the government to be installed in our Android phones. So that will give the result of the COVID positive persons in and around our surroundings. So similar to that, we can develop an app for the same a dispenser in such a way that the user can actually choose the whatever the, for example, mask is 4 numbers he needs, just like how we do it in Amazon. Mask for 4 numbers, sanitizers 2 bottles, and then give on pay, and then click on the QR code and give on and do the Google online payment. Then there's no human to machine interaction over here. I mean, the physical interaction is not over here. Only thing is that once the amount is being paid and it's being verified by the system, and this dispenser once understands that the person has paid and dispenses the necessary products. For example, masks for and uh, disinfect the sanitizers too. So those products will be there in this particular tray. So once the necessary things are there in this tray, the person can actually take the things from this tray and we can move out. But again, there is a possibility of infection. The infection to be carried out from this particular tray. So once the tray is being filled and the person has taken, then we have to go for designing an intelligent mechanism to detect, to go for automatic sanitizing of this particular tray for each and every use. So then only when the next person comes, again, the person can go for a contactless dispensing and taking the dispensing things without any risk of transmission of COVID. Another research opportunity out of this COVID is detection of masked faces. So face detection mechanism, probably it is a very common topic. Hopefully, like a few of the PhD students as well as a few of the MTech students would have come up with the projects on the face detection. So we have different algorithms and we have different procedures. All the things we have, and it's a very generic topic of research. But what about masked faces? Face with masks. So how we are going to detect a particular face with masks? So that is going to be the challenge over there. Okay. So face detection using the pattern recognition systems, it is very easy for automate the detection mechanism. Automate whether the detection mechanism. It is possible. But what about masked faces? And also how to detect when you look at this particular picture, a woman wearing the masks improperly. Okay, so here she is wearing somewhere in her in her chin, and this is also not proper, and this is on the forehead. So suppose so this particular system is designed in such a way that it will detect the persons whether the person has wear the mask or not. First, so suppose if the person has not wear the mask, then probably the concerned person, concerned health inspector or the official over there will be notified that the person is not wearing mask and the fine amount could be directed. Suppose if the person is wearing the mask and at the same time it is not he or she is not wearing properly. I mean, whether properly in the sense closing both the nostrils as well as the mouth. Suppose if he is not wearing in such a manner, then the system should be able to detect that also. Person is wearing a mask and also it is not in the proper way. So that things should also be captured and the person should be educated to wear the mask correctly. Okay, so such type of mask face detection is necessary when we have a relaxed lockdown. Suppose if people are partial lockdown, people are allowed to come out, but still there is a risk of transmission. So we have to ensure that people should be with masks and should follow the social distance. But still, because of our economic conditions, we have the government would have come to relax the strict lockdown. But still, there's a risk of transmission. In that cases, then this particular system will be able to detect whether the person is being masked or not, and whether there is a social distance between two people. There's 6 feet of distance. Again, one more important thing, detecting the person's identity. Okay, you consider, for example, we'll consider the most positive situation that all this COVID, everything gets cleared in the next few months, and colleges are all reopened, and you're all going physically to the colleges. Okay, but still there is a small possibility of a risk of transmitting the. I mean, there is possibility of transmission of virus. So still we need to wear the masks for the sake of the betterment of us as well as for the betterment of others. Okay, so in that case, suppose if you are entering into the classroom, so your faces could be recorded, and it could be using the pattern recognition. It could be matched along with the already existing face, and the masked face could be detected. And the person and the professor who's going to teach physically teach will be able to identify whether the person has come to the class or not. Okay, because whenever there is a physical teaching, then we have to maintain a social distance. So it is maintaining 6 feet, 6 feet. For example, if the class has about 40 to 50 people, the last person is over somewhere else, then are also wearing the mask, then the professor will not be able to look at him because of the distance thing. Suppose if we have an automated system just like this to detect the masked faces, then it will be very, very useful. This is one other research opportunity. Another research opportunity is like again, this is a thing where we go for a very positive, optimistic approach that COVID all settles down and education institutions are being run offline. I mean that like a physical classroom way of teaching is being followed in schools. But still, for a few days, we should ensure that the school students, for example, the school students are being masked as well as they maintain a distance of this 6 feet. Okay, so mask. So whether the student is wearing mask or not, we have seen how we can actually do it. So what we can do in order to have a insurance that we have to ensure that the students are actually sitting with the social distance in practice. Okay, so what we can do, we can have an app, just like an Arogya Setu app. So that particular app will 6 feet is being violated. Okay, for example, if the student moves close to another student, then probably this system should give an alarm to the supervisor that that these two people are not having a or probably by mistake they are not maintaining the social distance, so that they should be ensured for a social distancing. Again, taking the system onto practice, it involves a lot of discipline from the student side of also. Like they should be very, very disciplined in order to maintain, be aware, alert to maintain 6 feet distance as well as the face. So it all depends upon. Suppose the class is resumed, probably such type of solutions could be a research opportunity for physical classroom teaching. So over a few days, there was a huge problem of this medical oxygen for COVID patients. And there is also probably everybody would have been watching news, at least at this particular time of pandemic. There is a complaint that many of the oxygen cylinders have been looted from the manufacturing unit on the way to the government and private hospitals. Okay, so a few of the oxygen cylinders they're not reaching properly to the government and private hospitals. So in order to prevent that, what we can do, so one possible solution what I have come up is that we can actually go for an RFID system. Okay, the oxygen manufacturing or refilling, liquid oxygen, medical oxygen manufacturing company who once after refilling a cylinder will assign an RFID, and that particular RFID with that particular RFID, the cylinders have been transported to both government and private hospitals. So suppose in case if one particular cylinder is not it has not reached from the manufacturing company to any of the hospital, then we can very easily track that the cylinder has been looted by somebody, some group. Okay, so this is one of the research opportunity. So again, this is another thing, the efficient transport of medical oxygen to the COVID patients. So until for the past 2 weeks, previous 2 weeks, there was a huge demand for the oxygen, and there was a lot of struggles by the patients for getting the oxygen. So what we can do is that we can have a centralized, for example, corporation office where we can have an oxygen cylinder, huge oxygen cylinder, and the already existing electricity lines. Okay, electricity lines can be reused by and this oxygen could be transported using this electricity lines. Of course, by using a very good medium of transmission. Okay, this why actually we are going for this particular usage of this particular electricity line is that there's no use. There's because of this emergency situation, we cannot go for designing an architecture of how we can reach out to each and every home. So the way in which all the homes are connected is every home. I mean, all 90% of the home has electricity and a water connection. So using the already existing connection, how we can actually provide oxygen to the people at home quarantine. At times when the hospitals are being filled with, hospital beds are being filled and persons are being at home and still they need oxygen. So this is one particular possible solution where we can actually go for transferring the oxygen to the home itself through the electricity lines, not through the electricity lines, the electricity posts. This is another research opportunity. So very recently you would have come across this particular problem of people developing this black fungus infection. Okay, especially people who are elderly people who are patient. There is the possibility of getting of developing the black fungus infection by the post-COVID patient increases. So in such case, suppose if the patient develops, so there are few symptoms which is being given by the medical council for detection of COVID. Sorry, for the black fungus. So how the eyes gets red, and there is a passage of fluid, black color fluid through the nose, and there's swelling. All these things could be captured. And suppose if the person has all these things, then he can be given an alert that probably he has to go for he or she should go for a doctor for checkup for whether he has got this black fungal infection or not. It's just initial level, primary level detection of the black fungus infection. Of course, the regular medical tests are going to give the correct description and as well as diagnosis. So these are all the research opportunities what COVID-19 has brought out, and what as technologists, as engineers, what we can actually do to common people as well as the front-end healthcare workers, so that they in order to make their life easy during this particular difficult pandemic time. So with this, I just go to an overview of this smart healthcare system. So I'm not going to go deeper into it. I'll just cover the practical aspects of it, just like how I told the previous applications. Similarly, let me brief about this also. So now at this particular time, so everyone like everyone's mindset is like hospital, COVID, all these things are some terminologies which is going on and off from our mind. But apart from this particular COVID, there are other health issues which is being faced by people, even during this particular pandemic time. For example, low blood pressure, low sugar, or higher blood pressure, or hypertension. That is all. Apart from this COVID, the other difficulties they are actually facing. However, since this particular COVID is dangerous, deadly, we are actually hyper focusing upon it, but it is also important to focus on the other, for example, the cases regarding the accident or cases regarding neuro problem, sudden fainting of the patient. So many other complications, health complications are also there. Human beings are prone to such type of things, fits, seizures, all these things are possible. Okay, so in such a case, so how we can actually turn this particular system, healthcare system, the current healthcare system, into a very smart healthcare system. The current healthcare system is this: suppose if I go to a doctor, suppose if, for example, if I do develop seizure, fits, okay, then the fits, it should be treated immediately. Then suppose if I go to the doctor, I will be carrying what all the medicines I'm taking earlier. So the doctor should go through all the physical file, file with the papers and the folder. So that should be physically shared. However, during this particular pandemic time, it is very difficult for sharing of this particular physical files over there, even in between the patient and the doctor, because apart from this particular problem, there is a possibility of the risk of transmission of COVID also. So we should go for a paperless mechanism. I mean, we should be able to transmit. We should be able to give the doctors what is the previous medical condition of the particular patient who has been fainted. For example, a person has been fainted. At the same time, we should eliminate this paper-based PHS. PHS refers for a personal healthcare records. So one method by which how we can actually go for eliminating this particular paper-based healthcare records is we can have an electronic device-based healthcare records, which means we go for storing the healthcare records in an electronic device. For example, the memory of in a laptop. Okay, memory of a laptop. You are storing what are all the previous medications, what are all previous health conditions. Suppose in case if there is any surgeries, everything is being recorded. But again, there is a problem in this electronic device-based healthcare records. Okay, see, it is not really necessary to have a person's healthcare records on and on all the time, for all the time, because a person's lifespan is finite. Okay, and it is enough to have to save the healthcare record of one particular person until he is alive. After his his life, after his death, it is enough to store only the necessary details. For example, certain diseases that could be transmitted from that particular person to his children. So such type of information alone can be stored. The other information can definitely be destroyed because the person is no more. So healthcare records, it is not necessary for the system to hold it. It is actually the space is being wasted over there. But in case of an electronic device-based healthcare records, it is difficult to find the record of a person who is actually expired and deleted. All these things should be done manually. So it involves a lot of overhead. So what is the best thing is that we are bringing the cloud-based healthcare record into practice. Okay. So cloud is nothing but cloud is a central storage, central storage where we can go for. It's like a pay-as-you-go model. Okay. Whenever we need, we can go for storing it, pay and store the data in the cloud. And whenever we don't want, we can just stop the payment and the data will be deleted. Okay, just everything as a service, platform as a service, software as a service, infrastructure as a service, and even memory as a service. Okay, so it's like that. We're going for a web-based PHS. We are exploiting the term called cloud computing over here. So cloud. What is this? So we have, this personal healthcare records are being uploaded onto the cloud. Okay, so for a user over here refers to the patient 1, patient 2, and the patient end details are being stored onto the cloud. As I told you, cloud is a temporary storage. So how long you pay for that particular storage space, the information will be available and could be shared among different entities with the permission of the user. Suppose if you don't want, again you can also remove the same thing. And if you don't pay, again it will be removed automatically. So it is just like pay as you go model. Okay, just as a everything as a service over here. So this is one potential way by which actually we can go for a smart healthcare system, thereby reducing the physical physical transmission of paper-based files between the doctor and the patient, and especially in the case of emergency situation. Okay, this is about this. This is a small architectural representation. So how we should actually go for uploading the electronic healthcare records onto the cloud. See, cloud. There's one important thing we have to understand over here. I mean, we have to realize over here is that this is a centralized storage. So we go for storing our personal healthcare records on a public domain. See, anything which is being, any personal information which is being shared upon a public domain is subject to risk. Yes, sir. See, for example, suppose if you are sharing your photo on Facebook, or you just keep your photo as a DP in your WhatsApp, do you think it is safe? No. Anything which you, any information which you share it on a public domain is always subject to some amount of security risks. But taking the advantage out of posting this into a public domain, and we go for it is like a give and take. We go for it's okay, fine. This is not going to be a much big deal of security in this. Suppose if there is a security breach, then we can actually go for how we can handle that particular security breach also. But the important over here is that we should go for a public domain. By going for the public domain, we will be share the electronic healthcare record of one particular patient to one doctor at one particular hospital. Suppose if the same if one doctor wants to help, could also be sought by the files through the paper-based advantages in mind. We do for carrying this healthcare, but they also be we should also the aspects of the data is being stored in the cloud. So cloud security as such, it is a very big, very vast topic that is which I am not going to, which is not possible to cover in a webinar. As of now, we can understand that securing the cloud, security on the cloud is very important. And similarly, any unauthorized access to this particular healthcare records, that should also be dealt in detail. Okay, I'll just go on to this. Yes. So here you can have. So these are all the patients apart from COVID. I say for example, there's one person who's getting admitted in the hospital because of some head injury. Other person was so India and the hospital, then the person and the doctor over there can actually see the healthcare record of the particular patient and can come to a conclusion that because the person could be treated like this. And also during emergency situations, for example, if the person faints or if the person develops fits, okay, and there's a need for the person to, the person to be transported to the nearby hospital to treat it. Okay, But at that particular time, it is very difficult to tap their personal healthcare records. Suppose if they have in the paper file, then the patient should go there. The doctors should read through the files, understand what is the already existing medications and the existing condition of the patient, what he or she is allergic to, what types of medicines is he taking, what type of medicines is not taking, what is the food nature, whether the person is alcoholic or not alcoholic, whether the person is HIV positive or not. All these things are needs to be examined only after the patient has come. But in the case of a fits and stroke, the doctors cannot wait for a long time. They have to take action immediately. So in such a emergency of an emergency, too much of emergency of case, this particular such a scenario, this particular cloud-based healthcare record, cloud-based system would be very, very helpful. Because once a person is faints, then the healthcare records could easily be shared to the nearby hospital from where the ambulance is actually coming. And even before the person, the patient arrives at the emergency, the doctors on the at the emergency spot, the PG doctors or the handling doctors will be able to would have read the patient history and would have come to a conclusion that probably we can treat this particular person with these medicines, because he has been under the high blood pressure for about 20 to 30 years. So we cannot go give the huge amount of this medicine and go for another alternative medicine. So all these things, so accuracy of this particular first aid is very, very high when we go for this cloud-based healthcare record. Similarly, suppose if a patient is having an allergy, for example, some few people are allergic to penicillin drugs, amoxicillin drugs. So such things that should also be avoided. Suppose if the patient is being admitted in the hospital and he or she is unconscious, he is not able to tell that he is allergic to one particular drug, and similar type of drug is being given during first aid, then it may lead to the complication. It may complicate the situation much more. So in such a case, even before the person arrives, the doctor will be able to know, okay, fine, this particular person has a allergy towards nuts, allergy towards this particular type of medicine, allergy towards paracetamol, so allergy towards some medical chemical composition of medicines. Then probably we can drop out this particular chemical composition. We can go for another chemical composition of medicine and treat this particular person right now. So in general, actually, the how well this healthcare, the emergency, the first aid emergency is being given, how accurate it is being given, that is very, very important, as based upon it, the further investigations will get easier for the healthcare professionals. Okay, if the first aid which is being provided at the emergency department is 99% accurate, the person, for example, the person who was fainted and who's out of consciousness comes out to consciousness, then he's referred to another cardiologist or any neurologist. The cardiologist or neurologist will be able to treat a particular person very, very easily, very accurately, because the person has already been treated for this particular first aid very correctly. Okay, suppose if the first aid is not correct or somewhat a bit inaccurate, then the overhead is will go to the specialists. Okay, and they need to correct what is being done over there, and then they have to start the medications. So not to avoid all these complexities, we go for a cloud-based healthcare records. So this is an example of a cloud-based healthcare records. For example, I'm just clicking on, for example, there are many patients. So right now, you consider it is from the doctor's side. So on the doctor's side, from the hospital side, the doctors have received that some patient with the ID PT024 is under emergency. Okay, so they are going and they are so this particular record is to be investigated first. Okay, So ambulance has gone to the spot to bring the patient to the spot. Before that, the doctors at the emergency medicine will be clicking on this particular file. And in that, there are two types of, again, we go for segregating the records as generic records and surgical based records. Suppose if it is, generic records, it contains what are the general information like the person's age and the alcoholic nature and the other medications, basic information on why this particular medication has been given and whether the person has undergone a surgery, on when this particular surgery the person has undergone this particular surgery, and what is the reason, what was the pre-diagnosis for this surgery, who has done this surgery, and what is the post reason for this post improvement regarding the surgery. All these things are detailed explanation of the particular patient. So in case if the person, the doctor needs to investigate the patient's history very rapidly. There's no time, just 2 minutes of time, or just about 60 seconds of time. Then they can go for clicking on this particular general category. Okay, so general category will give what are all the basic things regarding that particular patient, and they can come to a conclusion that the patient should be treated like this. For example, specific for example, if the person if the person's the doctor needs to go for investigating even the surgeries and other things, then they can go for this surgical file. So this will give a broad overview of where, so probably this particular person has underwent a surgery on 2014, and 2015 there was one surgery. So two surgeries has been done, and what was the pre-operative diagnosis, post-operative diagnosis, and what is the medical history, what was there in that discharge summary, what is the specimens which was being taken for evaluation, procedures which is being performed, who was the surgeon, all the things, detailed things could be done over here, could be viewed by the doctors over here. Apart from doctors, so as I mentioned earlier, there is a possibility for another outsider to look into the personal healthcare record of this particular of any patient. Okay, since the data, the data is hosted onto the public, there should be an encryption scheme. There should be a security mechanism. Not an encryption scheme. In general, a security mechanism to secure the transmission of this particular data of the patient one to the cloud and from the cloud to the doctor. Suppose if there is another person, any other person who is not entitled to access this particular record, or he or she is somebody else, like any unauthorized user is using this particular record, then immediately the system should be designed with the security mechanism in such a way that whatever authorization procedures is being granted to that particular user, it should be terminated, it should be taken back, it should be revoked. So this is the one most important aspect out of going for this cloud-based system. So as I told you, any information which is being stored on the cloud, any information which is being stored on in a public domain is subject to risk. But still we go for it because of the huge number of advantages. Advantages overweigh the disadvantages. So that is the reason we go for it. Whenever there is an illegal user, probably that particular user should be identified and should be terminated from the usage of that particular healthcare records. Okay. So probably we know the advantages out of going for this type of web-based healthcare records. There's no need to carry the medical healthcare records. So to improve the quality of care provided, to increase the safety. For example, the patient's drug allergies and current medical conditions could also be transmitted to the doctors even before the patient arrives at the hospital. And medical tests, this is one important point. So suppose if a person has taken up a medical test, for example, a body's vital measurements, like for example, what to say, oh, a scan or an X-ray. So such type of medical records can be stored in the cloud. And suppose if the person wants to go to a second opinion to another doctor, it is not necessary for the person to take. For suppose the other doctor from another hospital, it's not necessary to repeat the test. Apart from certain tests it should be repeated. For example, blood pressure, probably it changes from day to day. Okay, temperature, it changes from day to day. But certain things for a period of time it doesn't change. Okay, such type of records could be actually stored as an electronic web-based healthcare records, and it could be used. It could be viewed by the other physician in another hospital, and thereby reducing the charges of repeating the tests. Anyhow, if suppose if there's an X-ray for a fracture, it is going to be like, it's not going to change in 1 week's time. Okay, it takes some time. Okay, so probably within a week that particular record could be reused. And solving the key generation issue is a very important term, important point while considering the cloud-based systems. So with this, I conclude my talk. Of this webinar. So probably in this webinar, initially we have seen a lot of practical applications. So what is the current scenario of the COVID, and how the smart mask and the dispenser, and how to go for this mask reduction, social distancing, ensuring, and other research opportunities out of this COVID-19. And we have also seen about this smart healthcare system, the web-based healthcare system, that is very, very important in the case of an emergency medicine, also during this particular pandemic. So, with these few words, I thank everyone, all the students who have attended to this particular webinar. My special thanks to Dr. M. Mahesh, Professor and Head of the Department, for inviting me for this seminar. And my special thanks to my dear friend, Dr. R. Mohandas sir, for extending the personal invitation for the webinar. And also my thanks to Mr. Vinod Kumar sir for the excellent coordination of the conduct of this webinar. So students, if you have any questions, you can reach out to me. You can either ask me or you can reach out to me at this particular email. I will be able to answer to you within a couple of days. Thank you.
Thank you, Dr. Balamurugan sir. Participants, you have any doubt, you can open your, you unmute yourself and you can have a discussion with sir. Okay, Armugam sir has been given very good presentation and valuable suggestions are restored. Thank you, Armugam sir. Vinod sir? Vinod
yes,
sir?
Yes, sir. Yes, sir. I am available, sir. Yes, sir.
Yes, sir. You just carry on, sir.
Yes, sir. Yes, sir. So that was a brainstorming session we had, sir. Actually, the UG students, those who are in the final year as well as in the sixth semester, they will get some ideas, mind-sparking ideas in this. As you told already, many overwhelming responses from the students also we got, because it is ideas they can proceed with that. So that platform you laid for us, sir, it was a very nice and excellent session, sir. Thank you for sharing your ideas with us and sparing a golden time with us, sir. So thank you very much, sir. And I thank our management, principal sir, and also the HOD sir of our electric and electronics department. And last but not the least, our students participants. So for participating in this wonderful webinar. So I thank each and everyone. So for their participation. Thank you very much, sir. Thank you, sir. So we will try to share the feedback in the chat box, participants. Just bear with us. So kindly fill your details correctly in that, so that you can receive the webinar certificate within a day or two. So we are trying to share that also.